Question 1. In a patient with sepsis, which assessment finding indicates improved perfusion? A. Decreased capillary refill time. B. Increased skin pallor. C. Decreased urine output. D. Mottled skin appearance. Answer: A. Decreased capillary refill time. Question 2. The nurse is caring for a patient with sepsis. Which action must be completed first? A. Start enteral feedings. B. Obtain blood cultures. C. Insert Foley catheter. D. Place on telemetry. Answer: B. Obtain blood cultures. Question 3. A patient is admitted with sepsis and hypotension. The nurse anticipates which initial order? A. Blood transfusion. B. For bolus of isotonic fluids. C. Initiate enteral nutrition. D. Start corticosteroids. Answer: B. For bolus of isotonic fluids. Question 4. Which nursing action is most effective in preventing healthcare-associated sepsis? A. Administer prophylactic antibiotics. B. Ensure early ambulation. C. Perform hand hygiene consistently. D. Place patient in isolation. Answer: C. Perform hand hygiene consistently. Question 5. A septic patient's mental status is declining. What should the nurse do first? A. Administer sedatives. B. Assess oxygenation status. C. Document changes and reassess later. D. Provide reassurance to the family. Answer: B. Assess oxygenation status. Question 6. A nurse notices that a septic patient has cool, cyanotic extremities. What does this indicate? A. Compensated shock. B. Early recovery. C. Worsening tissue perfusion. D. Expected response to antibiotics. Answer: C. Worsening tissue perfusion. Question 7. In the event of septic shock, which organ system is typically prioritized for monitoring? A. Integumentary system. B. Musculoskeletal system. C. Renal system. D. Gastrointestinal system. Answer: C. Renal system. Question 8. A nurse is caring for a patient with sepsis on vasopressors. What is the primary goal? A. Increase urine output to 200 milliliters per hour. B. Maintain MAP greater than or equal to 65 millimeters of mercury. C. Normalize body temperature. D. Achieve glucose level below 80 milligrams per deciliter. Answer: B. Maintain MAP greater than or equal to 65 millimeters of mercury. Question 9. What is the most reliable indicator of early improvement in a septic patient receiving fluids? A. Decrease in lactate level. B. Increase in temperature. C. Bradycardia. D. Increased capillary refill time. Answer: A. Decrease in lactate level. Question 10. A nurse is caring for 4 patients. Who should be assessed first? A. Patient with sepsis and HR 120 BPM. B. Patient with sepsis and BP 110/70 mmHg. C. Patient with suspected UTI. D. Post-op patient with no complaints. Answer: A. Patient with sepsis and HR 120 BPM. Question 11. What should the nurse monitor closely when administering large volume fluid resuscitation? A. Blood glucose. B. Lung sounds. C. Bowel sounds. D. Skin color. Answer: B. Lung sounds. Question 12. In a septic patient, a sudden drop in platelet count may indicate which complication? A. Liver failure. B. Disseminated intravascular coagulation DIC. C. Renal insufficiency. D. Hypokalemia. Answer: B. Disseminated intravascular coagulation DIC. Question 13. A nurse delegates a UAP to assist a septic patient with hygiene. What should the RN reinforce? A. Instruct to limit oral intake. B. Encourage active range of motion. C. Notify RN if patient becomes confused. D. Withhold oral care if febrile. Answer: C. Notify RN if patient becomes confused. Question 14. Which intervention should the nurse question for a patient in septic shock? A. Begin norepinephrine infusion. B. Administer 4 broad-spectrum antibiotics. C. Withhold fluids due to pulmonary edema risk. D. Obtain repeat lactate level. Answer: C. Withhold fluids due to pulmonary edema risk. Question 15. The nurse receives new orders for a septic patient. Which order should be completed first? A. Chest X-ray. B. Blood cultures. C. Physical therapy consult. D. Dietitian referral. Answer: B. Blood cultures. Question 16. Which statement about sepsis education for patients is most accurate? A. Sepsis always begins in the hospital. B. Only elderly patients are at risk for sepsis. C. Early treatment can prevent severe complications. D. Vaccines are ineffective against sepsis. Answer: C. Early treatment can prevent severe complications. Question 17. Which symptom suggests a patient is entering refractory septic shock? A. Responsive to fluid boluses. B. Increasing MAP with vasopressors. C. Decreasing urine output despite therapy. D. Decreasing need for oxygen therapy. Answer: C. Decreasing urine output despite therapy. Question 18. The nurse evaluates effectiveness of fluid resuscitation by which assessment? A. Decreased hematocrit. B. Improved skin turgor. C. Increased oxygen saturation. D. Increased MAP. Answer: D. Increased MAP. Question 19. A nurse prepares to discharge a patient treated for sepsis. What education is priority? A. Encourage immediate return for infection symptoms. B. Limit mobility for 2 weeks. C. Take OTC supplements. D. Restrict fluid intake. Answer: A. Encourage immediate return for infection symptoms. Question 20. The nurse notes a new onset of confusion in a patient with sepsis. What is the first action? A. Place the patient in restraints. B. Notify the provider immediately. C. Administer a sedative. D. Provide 1 liter oral fluids. Answer: B. Notify the provider immediately. Question 21. A patient with sepsis suddenly develops petechiae. What should the nurse do first? A. Apply compression stockings. B. Notify the healthcare provider. C. Encourage oral fluid intake. D. Document the finding as expected. Answer: B. Notify the healthcare provider. Question 22. A patient with sepsis has a lactate of 6 millimoles per liter. What is the nurse's priority action? A. Encourage deep breathing. B. Notify the provider and prepare for aggressive treatment. C. Monitor bowel sounds. D. Restrict protein intake. Answer: B. Notify the provider and prepare for aggressive treatment. Question 23. A nurse notes that a septic patient's urine output has decreased to 10 milliliters per hour. What is the first action? A. Document and monitor trends. B. Increase oral fluids. C. Notify the healthcare provider. D. Check hemoglobin levels. Answer: C. Notify the healthcare provider. Question 24. Which assessment finding indicates potential progression to MODS in a patient with sepsis? A. Heart rate of 82 BPM. B. Glasgow Coma Scale score of 8. C. BP 130/80 mmHg. D. SpO2 95% on room air. Answer: B. Glasgow Coma Scale score of 8. Question 25. Which assessment finding in a septic patient would require immediate intervention? A. Temperature 99.0 degrees Fahrenheit. B. Urine output 20 milliliters per hour. C. Respiratory rate 18 per minute. D. Pulse 88 BPM. Answer: B. Urine output 20 milliliters per hour. Question 26. A patient is at risk for sepsis due to neutropenia. What is the nurse's priority intervention? A. Administer routine vaccines. B. Perform meticulous hand hygiene. C. Place the patient in full isolation. D. Increase fluid intake. Answer: B. Perform meticulous hand hygiene. Question 27. In septic shock, which lab finding indicates worsening perfusion? A. Blood glucose 105 milligrams per deciliter. B. Hematocrit 40%. C. Increased serum lactate. D. Platelets 150,000/mm superscript 3. Answer: C. Increased serum lactate. Question 28. A nurse should delegate which task to a UAP caring for a patient with sepsis? A. Assess lung sounds. B. Administer oral antibiotics. C. Measure and report urine output. D. Evaluate fluid resuscitation response. Answer: C. Measure and report urine output. Question 29. A nurse is teaching about sepsis prevention for at-risk patients. What should be emphasized? A. Take vitamin supplements. B. Avoid all hospital visits. C. Report any signs of infection early. D. Wear gloves when outside. Answer: C. Report any signs of infection early. Question 30. Which of the following is the priority nursing action when managing a patient in septic shock? A. Administer antihypertensive medication. B. Provide nutritional supplements. C. Initiate large volume fluid resuscitation. D. Apply sequential compression devices. Answer: C. Initiate large volume fluid resuscitation. Question 31. Which is a key component of the initial sepsis bundle? A. Start vasopressors before fluid resuscitation. B. Administer blood transfusion. C. Administer antibiotics within 1 hour. D. Delay antibiotics until cultures return. Answer: C. Administer antibiotics within 1 hour. Question 32. Which vital sign is the most sensitive early indicator of sepsis? A. Respiratory rate. B. Blood pressure. C. Temperature. D. Pulse oximetry. Answer: A. Respiratory rate. Question 33. The nurse is monitoring a patient on norepinephrine for septic shock. What should be reported immediately? A. Increased heart rate. B. MAP 68 millimeters of mercury. C. Decreased capillary refill. D. Pale cold extremities. Answer: D. Pale cold extremities. Question 34. Which statement by a patient suggests a correct understanding of sepsis risk? A. If I feel dizzy or confused, I should seek help right away. B. Sepsis only happens after surgery. C. I should stop taking my medications if I get sick. D. Vaccines do not help prevent sepsis. Answer: A. If I feel dizzy or confused, I should seek help right away. Question 35. In sepsis, why is it critical to monitor glucose levels even in non-diabetic patients? A. To prevent renal failure. B. Hyperglycemia increases mortality risk. C. To avoid liver dysfunction. D. To enhance antibiotic absorption. Answer: B. Hyperglycemia increases mortality risk. Question 36. Which assessment finding indicates fluid overload in a patient receiving aggressive fluid resuscitation? A. Increased skin turgor. B. Crackles on auscultation. C. Decreased blood pressure. D. Tachycardia. Answer: B. Crackles on auscultation. Question 37. A nurse is reviewing discharge instructions with a patient who had sepsis. Which is most important? A. Limit daily fluid intake. B. Resume normal activity immediately. C. Monitor for signs of infection. D. Avoid all physical activity for 2 weeks. Answer: C. Monitor for signs of infection. Question 38. Which finding supports the diagnosis of septic shock? A. BP 120/80 mmHg. B. Increased urine output. C. Elevated lactate despite fluids. D. Mildly elevated temperature. Answer: C. Elevated lactate despite fluids. Question 39. What is the nurse's priority action for a septic patient with worsening hypotension? A. Prepare for transfer to ICU. B. Elevate the head of the bed. C. Notify the provider immediately. D. Start a blood transfusion. Answer: C. Notify the provider immediately. Question 40. Which of the following is a common cause of sepsis in hospitalized patients? A. Fractured bone. B. Pressure injury. C. Viral sinus infection. D. Closed head injury. Answer: B. Pressure injury. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.